This is the guy that I credit for my understanding of the body, the way the body fails. Okay, Vladimir Janda, hugely important for every physiotherapist that's working now. Almost all of them will agree that there are postural issues that lead to pain. There's some small segment of the world of physiotherapists that are trying to make a name for themselves by saying that this is not true, but then they have no explanation for how the pain is actually happening. When you understand what Vladimir Janda taught us, you understand the muscles that are prone to getting tight and the muscles that are prone to getting weak. He said there's two main schools of thought in musculoskeletal medicine, structural and functional. That's the problem with our medicine today. Our doctors specialize in the joint that they do surgery on. They don't care that the knee is affected by the hip or the ankle. They're just looking at the knee. And to them, your problem is inflammation, overuse, and you better lose some weight. And that's not the way we look at things. And we get great results even for people who are overweight, even for people who have been diagnosed with osteoarthritis of the knee, because we correct the dysfunction that leads to that. So we're looking functionally, they're looking at structure. And when you look at structure, you're missing the whole picture. The muscle can be strong as possible, but if it doesn't fire at the right time, it's useless. So when we talk about proprioception, remember that when you have a disruption of your sensory nervous system that tells you where you are in space, things don't fire in the right order. They have latency. So that's important to remember. When you don't have maybe transverse abs that are supposed to have a feed-forward mechanism and engage before you move, you're more at risk of hurting your back. Things work together in slings, chains, and loops. That's what we're going to be talking about later. Compensations within chains create more dysfunctional movement. We'll talk about that. How an ankle issue can cause you to overuse your hip, and how overusing your hip is now causing low back issues. Pelvic chain is the key to most musculoskeletal function. If you've had to go through physiotherapy or your patients have gone through physiotherapy, most of the time, if it's something from the ribs down, they're working on their glutes, because the glutes are the key to everything. And that could even go for upper body. And we'll talk about how that works. Often the site of pain is not the cause of pain. And that's absolutely the case. When we talk about the psoas, we'll talk about how you'll have pain at L4, L5, but it's coming from your hip. And then first and foremost, normalize the periphery and increase proprioceptive input. Get your patient out of pain. Like, something so frustrating to me in the acupuncture world is somebody who says, oh yeah, my patient has low back pain, but I need to treat the root. So they want to spend like 3 months, supplementing qi. And I say, get them out of pain. They came in pain, get them out of pain. And you can do that in that treatment, in that one first visit. You have a short intake, please lie on the table. 20 minutes from now, they're off the table and they're way better. We can do that. And I don't care about your kidney chi. That's someone else's problem. Tonic and phasic. Tonic is something that's constant. That's your postural muscles. Muscles that are constantly holding. And those, by the way, are the ones that are more prone to having trigger points. Muscles that have to constantly hold at a low level of force. And then your phasic muscles are the ones that are used intermittently. Those are our power muscles. You know how when you run upstairs, your quads and your glutes will fatigue. Your calves will never fatigue. Your calves can hold you up all day long because those are tonic. They have the twitch, the fibers that are not going to fatigue. Glutes and quads will fatigue. If you've ever done leg day and then you can't even go down the stairs, one, congratulations, good workout. But that's because they'll just fail. So the tonic muscles, that's our slow twitch dominant. Those are the ones that don't fatigue. But they're the ones that are going to get tight on you. Neck muscles, hip flexors, those all get tight. And then our fast twitch dominant phasic muscles are the power muscles that fatigue easily. So I'll run through this quickly. Upper cross syndrome, if you haven't heard of it, it's the forward head placement. It's because of those tonic muscles getting tight, phasic muscles getting weak. And then lower cross, which is relevant for what we're doing. Abdominals get weak, glutes get weak. Low back gets tight, hip flexors get tight. This is what it is to be human. It's not just possibly going to happen to you. It's happening to you now. All of this is happening to all of us, and it's just a progression. If we're lucky enough to live long enough, we will have postural issues that lead to pain. And we can resolve that with needles. The sensory motor system, that's a term that Dr. Janda came up with because he recognized that the problem wasn't just muscles and it wasn't just the motor function of the body. The sensory system is relevant to how your body moves. So we're going to talk about how we have proprioceptors at the joints, fascia, muscles, and then we have the sensory nervous system, the peripheral nervous system, all working together as one system for motor control. So I need to talk about that so that when we talk about myofascial slings and we talk about proprioception, you understand that motor control is what is essential to not injure yourself. And when you have disrupted sensory input from your fascia or your muscle spindles, you're more prone to injury because your body doesn't actually accurately assess where you are in space. And we can correct that for people. And we can make big improvements even for older people. So I talked about proprioception. It's the perception of movement and position, essential for motor control. So it's sort of like, the sobriety test, right? If you don't have good proprioception, you can't touch your nose. And alcohol screws all of that up. So this is really, really important. You hear about elderly people who fall over. They're showering and they fall in the shower. When they close their eyes, they no longer have the visual input that allows them to maintain balance because they've lost so much proprioception. Maybe they can't even feel their feet. I know you guys have those patients, I do. Maybe they can't even feel their feet. They need visual cues to not fall over. And if they make the mistake, get suds in their eye and close their eye, they could just fall. They don't even know it. They don't even know they're falling. So we need movement needs sensory feedback. Joint stability needs sensory feedback. Injury avoidance needs sensory feedback. All of that input is instantaneous, and it's done at a subcortical level. We don't even know it's happening. So proprioception ABCs, the three aspects of proprioception: agility, balance, and coordination. Agility is capability to control the direction of the body during rapid movements, while balance is the ability to maintain equilibrium by keeping the line of gravity of the body within the body space of support. And then coordination is the smoothness of activity. This is produced by a combination of muscles acting together with appropriate intensity and timing. This is why a lot of us no longer do cartwheels, because we don't have that coordination anymore. Our bodies are way too tight. We don't have the joint stability, and we certainly don't have the coordination to do the things that we could do when we were in our 20s. At least I don't. I'm not doing cartwheels. So mechanoreceptors are part of proprioception. We have these different levels of sensory input that tells our body where we are in space. Articular mechanoreceptors, those are at the joint capsule, myotendous junction, ligaments, fascia, stretch, compression, active tension. So then you have muscular receptors. These are the most relevant to those of us treating motor points. Our muscle spindles can shorten and not feel where they are in space. Do you ever have low back patients and you've got electric stim going on their low back and they say, I can't feel it? They don't have the proprioception. Their proprioception is disrupted by muscle shortening. They can't even feel it move. And you have to assure them it's moving. And I'm going to stand here for a minute until you can feel it, because I know you'll feel it when it loosens up enough. But that happens. And then exteroreceptors is like feeling your skin stretch. But all of this is important. Skin stretch is important too for motor control, and this is why you should consider treating scars. You can do surround the dragon type things, get under scars. Carl Levitt was big on acupuncture, especially for things like treating scars, treating trigger points, things like that.